certainly there are some critics who say this is a conference full of politicians sitting in their ivory tower and completely separated from the reality on the ground in Syria. But here in Brussels, there are no apologies for holding this conference. They say the people in Syria who are caught up in this war cannot wait for it to be over before they receive aid. Also, this conference will be talking about a post-war Syria, so putting in place the foundations that are needed to ensure that Syria is stable once the conflict is over, to try and stop it slipping back into conflict. But really, between now and then, there is a lot to do, and a lot of money does need to be raised. We've heard from the UN that they suspect $8 billion is needed just this year alone to meet the humanitarian needs on the ground in Syria. We know that around 7 million Syrians are in critical food need as we speak. But there's more than just food that needs to be dealt with here. And of course, health and medicine is just one of the many areas that are going to need funding. And I'm joined now by the World Health Organization Regional Emergency Director for the Middle East, Michel Thieren. Thanks for joining us. Can you give us paint a picture for us? What is actually happening on the ground in Syria when it comes to medicines and hospitals and helping people?
It's obviously a very bleak picture, expectedly. You have virtually the public health of an entire country that is collapsing. Why is it collapsing? Because the health demands is the demand of 13 million people left unattended. 70% of the workforces have, the health workforce, the doctors, nurses and everything, have left the country. You have almost an equal rate of health facilities that are unoperating. I'll give you an example. We can't silence what happened yesterday. The hospital of Idlib, where this event has happened, is not in a capacity to absorb this. The hospital of Idlib has been destroyed by the country, and the victims coming out of what is a war crime, the victims that coming out of this scene have been now unattended. Many are actually being referred to southern Turkey hospitals and attended there, fortunately. And WHO is now, with other agencies, shipping whatever treatment is appropriate for taking care of those dozens, hundreds of adults and children. Many of them already died. So this event yesterday is very exemplative of both sides. A horrendous conflict with large amount of war crimes committed, assault against health and healthcare, and a huge demand of a population in very bad health condition, and service providers inoperating. This is the result of almost 7 years of conflict, and WHO is constantly on the ground, shipping drugs, shipping treatment, attending that.
You need money, though, to do what you need to do. And we know in London last year at this conference, nearly $12 billion was pledged by the international community. A portion of that, of course, was allocated to health. Is that money actually making it from the point of being pledged by politicians to the ground in Syria?
Historically, the money has been coming at 30% rate, which is very low. We entered 2017 with 6%. We are only in April, but linearly we are severely underfunded. And we are talking about kids not immunized. We're talking about adults that are that cannot take their daily treatment, diabetics, dialysis, tuberculosis. We all have the impact of chronic disease that is summing up. Every $1 million missing result in 250,000 people unattended. So we are talking about almost, in the coming year, 13 million people who will be in need of medical care and won't have it. We talk about 5 million people who will be in need in emergency medical care and will not have it. And even 300,000 of those people will need relief, life-saving surgery and will not have it.
Those numbers are just enormous.
The numbers are terrible. And the numbers is nothing but a multiplier of one single tragedy if the life of someone. And that must be highlighted.
Well, there you have it. Huge numbers there, and obviously here in Brussels, the politicians meeting here are going to be looking at ways to make sure the money that is pledged today and last year actually makes it to the people who need it on the ground in Syria.